Hi, I'm Dr. Behnaz. If you ever leaked a little urine when sneezing, exercising, or even just walking to the bathroom, you're not alone, and this video is for you. Urinary incontinence is one of the most common misunderstood pelvic floor problems. You might have found yourself asking, is this just part of getting older? Why did this start after I had my baby? Or even, do I have to live with this forever? I want you to know. This is not your fault. And there are real evidence based solutions. Today, I explain what urinary incontinence really is, why it happens, and how we evaluate and treat it through pelvic floor physical therapy. Let's walk through it together. What's urinary incontinence? Urinary incontinence simply means leaking urine when you don't want to. That could look like a few drops during a workout, not reaching the toilet in time, or noticing dribbles even after you thought you were done. This is not about a poor willpower or aging, it's a dysfunction in the pelvic floor system and it can be corrected. How your pelvic floor, bladder, and brain work together. Let's break this down. Your bladder stores urine from your kidneys. Your brain sends signals when it's time to go. And your pelvic floor muscles help keep the bladder and urethra closed until then. When these systems work together, you stay dry. But with incontinence, one or more parts of this loop is disrupted. This might be caused by weak or uncoordinated pelvic floor muscles, hormonal shifts like after childbirth or during menopause, nerve or tissue changes from surgery, delivery, or trauma, and even habits like just in case peeing. I want to talk about the four most common types of incontinence. Stress incontinence. This happens when pressure increases, like when you sneeze, run, or lift something heavy. If your pelvic floor isn't fast or strong enough, it can't keep the urethra closed during those sudden movements. And then the other type of incontinence, it's urge incontinence. This is the I have to go now feeling, often followed by leaking. It happens when your bladder contracts too early or too strongly. This may be due to nerve sensitivity, poor relaxation habits, or bladder irritants. The next type of incontinence is mixed incontinence. Many people experience a combination of stress and urge symptoms. It's especially common in women who are postpartum or postmenopausal. And overflow incontinence. This is less common and usually caused by neurological that prevent full bladder emptying. Okay, so let's see how we assess incontinence in physical therapy. In pelvic floor therapy, we use a comprehensive person approach to understand your specific condition. Here is how we start. We start with bladder diary. You'll track things like how often you go, when leaks happen, what triggers them, cold, laughter, exercise. So, what you drink, like caffeine or bubbly drinks, and then we do internal and external pelvic floor exam. We assess muscle strength and tone, coordination. Can you contract the pelvic floor without squeezing your glutes or abs? So we also check out your endurance. Can you hold a contraction for 10 seconds or do fatigue after 2 seconds? And then we'll do functional testing. We observe your body works in daily life. Are you bearing down instead of lifting up? How does your breathing coordinate with movement? We are not just evaluating you while lying down. We test your system during real life movements. Okay, let's see what treatment looks like. Pelvic floor therapy, it's not just about doing Kegels, it's about retraining your entire system. Here is what we focus on. So we are focusing on finding the right muscles. Many people don't know if they're doing a pelvic floor contraction correctly. I want you to imagine that you are picking up a blueberry with your vaginal opening. You also make sure you're not holding your breath or clenching your thighs. And then we are also training your breath. A lot of patients accidentally bearing down when they should be lifting. We retrain your breathing so that you inhale to prepare, you exhale as you contract, and then fully relax between repetitions. So we are also improving your bladder habits, avoiding just in case trips to the bathroom, calming your bladder during urgency, using the right toilet posture, feet supported, leaning slightly forward. We also adjusting for hormonal changes. After pregnancy and during menopause, tissues can become thinner, reflexes slower, and pressure control reduced. We adapt your therapy to this. More gentle techniques, slower progressions, hormone aware care, often in coordination with your doctor. So, let me share you a case. A 40-year-old postpartum woman came in because she leaked urine when lifting her toddler. She was burning down and overusing her abs. Her evaluation showed weak pelvic floor muscles, poor breathing coordination, no pelvic floor activation before lifting. We started with basic pelvic floor activation while lying down, breathwork techniques, and also teaching her to use the neck technique, a quick pelvic floor squeeze before lifting. And then we integrated this into her childcare activities. After 6 weeks, she was no longer leaking. By week 8, she returned to running comfortably. Key takeaways for you from this video. Urinary incontinence, it's treatable no matter your age or history. It's not just about doing Kegels, it's about using the right treatment for your unique situation. Posture, breathing, bladder habits, and hormones all matter. With the right care, you can regain control and confidence. So, what's next? In our next video, I dive into stress incontinence, what causes it, and exactly what we do in therapy to help you stop leaking when you laugh, jump, or lift. If you're ready to take the next step in healing, subscribe and follow. I'm Dr. Behnaz, and remember, you're not broken. You just haven't gotten the right care yet.